All right, hey, Matt Gover with XL Fitness and Performance. We're going to talk a little about runner's knee and tight quads that the quads just get hammered with running. Even if you're running with good technique, those legs are going to get pretty nailed and get knotted and tight. Realize, like with muscles, when they're not sliding freely across each other, if there's knots in them, the muscles themselves don't contract very well. They lose elasticity, and they're more prone to injury. So we just need to take care of ourselves, get rid of those knots, get rid of those adhesions, and keep our muscles sliding well, which is going to come back a lot to dehydration. Make sure you keep your water intake high so that the muscles are going to slide over each other a lot better. So as runners, our front wheel drives get really knotted up, so we want to try to break these down a little bit. So you can use a foam roller. I kind of consider this kind of like the jackhammer for soft tissue work. It might be very effective at first, but eventually you're going to want to really get down and get down and dirty with a smaller tool like a lacrosse ball. So something that's a little harder, where you can really fine tune and chisel out those tender areas. So let me demonstrate with the roller first, and we'll move on to the lacrosse ball. So with the foam roller, you're going to get down on top of the roller, and we're going to start right up by your hip bone, and you're going to roll up and down, side to side. Ideally, we want to try to smash that tissue across the grain of our quads. So our quads are running up and down this way. We want to smash across it and try to find those tender areas. So rolling up and down, side to side. When you find the tender area, you've got a couple options here. You can kind of roll back and forth to try to smash it, or you can contract, relax, meaning get on top of that tight area, contract your muscle, just isometrically hold it for about 5 seconds, and then relax and try to melt over top of the roller for about 10 seconds, and then repeat. You want to keep doing that until you notice change, meaning the tenderness should decrease a little bit. Another option you can do is tack and floss. That's where you find a tender area, tack it down with the roller, and then you're going to floss it back and forth by flexing your knee. Do that a little bit, and you're going to notice that pain, once again, it's going to decrease a little bit, and it's going to kind of loosen up. All right? So those are a couple strategies you can do. You want to cover the entire front side of your thigh. Also get down here on the side, and also on the inside. So you're trying to just cover the entire front. Okay, so you're going to spend some time on the foam roller. You can get these quite a few places. We have them for sale here at XL. These are a harder foam roller than most. They last a lot longer than the softer foam rollers, which you probably use up in just a couple of months. So let me show you about the lacrosse ball. I like the lacrosse ball better than a tennis ball or a racquetball because it's firmer. You're going to get a lot more better results with it. A general rule of thumb when you're doing soft tissue work is you don't want it to be damaging. So you should know the difference between kind of good pain and bad pain. If it feels like you're doing some damage, then lay off it a little bit, take some of the pressure off it. But likewise, if you feel like you handle more, put a little more pressure on it. So we're going to spend some time in this suprapatellar pocket right above the knee, especially on this VMO where the quadriceps come in. This is one of the places runners, that just gets nasty in there. So we're going to take the lacrosse ball, and I want you to spend some time moving around in there, find those nasty bits, those tight, tender areas. Once again, when you find the tight, tender area, you can contract that muscle isometrically, just hold it for 5 seconds, and then relax and let it melt over that ball. Likewise, you can tack and floss, find that tender area, and then flex your knee back and forth over top of it. Working all around above your kneecap to the outside of your knee. Just seek out and destroy those tender areas. The next area I want you to focus on is your flexor wad. It's right up here, kind of where a pocket would be on a pair of jeans. You've got your tensor fascia lata up here, you've got your rectus femoris, your sartorius muscles all tie into here. And especially if you're doing much trail running, this is just going to get really nasty, really just gristly. So take the lacrosse ball once again, and you're going to get right up in that hip flexor area, hip flexor wad. Same techniques, rolling side to side, kind of cross tissue, You can do the same contract, relax, tack and floss is a little harder on this, so contract, relax is probably going to be your best option. My suggestion is spend a significant amount of time here. I would spend 5 minutes on each leg, so 10 minutes total. Like, you want to do enough tissue work to where you get change, meaning you should notice a decrease in pain. You should notice more flexible, pliable muscles. Make sure you're properly hydrated, because you're kind of going to be counterproductive if you're dehydrated. So drink plenty of water, and that's just just drink plenty of water. Okay, so after you've done that that soft tissue work, we're going to go into a stretch. We're going to start off with a half-kneeling quad stretch. You're going to need a wall on this, and you're going to put your knee in the corner of the wall on the floor with your leg up. This would be level 1 right here with my other knee on the floor. Let me grab my roller. So I want to be here. I want to make sure my core is engaged here so I'm not hyperextending and arching. This glute is going to be fired. That's going to help keep my back neutral. So this is level 1. For a lot of you, this is going to be super tender. It's going to be a pretty aggressive stretch. I want you to hold this stretch for 2 minutes. You're going to do 2 minutes on each side. So 5 minutes rolling out and doing soft tissue work on each leg, 2 minutes stretching on each leg. While you're here, I don't want you just kind of hanging out here and thinking about what you did last night. I want you to do some contract, relax. So contract that muscle, the quad muscle, for 5 seconds. Relax, and you'll be able to sink into a deeper stretch, come up into a deeper stretch. The next level on this stretch would be getting this foot out in front. Once again, glutes are engaged, spine straight up and down. I like to use the roller for support. As I'm doing my contract, relax, and that muscle loosens up, I'm able to come up taller. I can even come up and bring my arms above my head to even get a better stretch. But once again, contract, relax. 5 seconds contracting, relax for 10 seconds. All right, so I want you to spend 2 minutes in this stretch, accumulate 2 minutes at a time, but just don't just hang out here. Try to do that contract, relax. Like I said, do a couple sessions of the soft tissue work with the stretching. We're talking 15-minute commitment here. Couple sessions in your legs are going to seriously love you back. So the next stretch I want you to work on is kind of work on that hip mobility. This will help with IT band syndrome, some of that runner's knee, teletendonitis. So you're going to be, we call this a half kneeling or a modified Spider-Man stretch. Foot's going to be on the floor, and you can either hold the foot so it stays flat, or if you can keep your foot flat, you're going to use this hand to push that knee out, and keeping your spine straight, so I don't want to see you round your spine here or arched and swayed. Keep the core engaged, and you're going to explore around here in your hip joint. Keep the belly button pointing straight to the floor at first. Work here. Then you can turn your belly button towards that knee. Work a little bit more. When you find a tender area, you can kind of scour that corner, that tender area a little bit. You can also do contract, relax here. Hold for 5 seconds, relax. Work on all those different angles. Lastly, you can bring that foot more in front of you, and now you can work with the foot up on its edge. You're going to notice you're going to get some different angles there in your hip. So start with the foot flat, belly button to the floor, move around, turn your belly button towards that knee, keep the foot flat, work that area. Bring your foot more in front of you, go up on the edge, and then work those corners. When you find a tender area, just kind of floss it back and forth. You can also do contract, relax. So 2 minutes again on each side of those stretches. You're talking less than 20 minutes, but I can't tell you how much better your legs are going to feel. So specifically for runners, runner's knee, IT band syndrome, all those kind of things. So thanks for tuning in, and yeah, Matt the Trainer out.